Okay, a common task that one has to do in the healthcare setting is to walk or ambulate a patient or a resident. So I want to make sure that you're doing it in the proper way so that you don't hurt your back and so that it is the easiest way for the resident or the patient and the easiest way for you. Now Brad already explained the proper ways to take the footrests and get them out of the way, so we've already done that. The other point I want to make, or the initial point I want to make, is how difficult it is for a patient to get out of the chair if they're not allowed to lean forward. And this is something we don't think about, we just naturally do. But our saying to the patient, quite often we use, is nose over the toes. Lindsay, what I'd like you to show the people out there right now is how difficult it would be for you to stand up if you were not able to lean forward. Just try to stand straight up. Yeah, it just doesn't happen, does it? It's just very, very difficult. She might be able to do it if she used her arms, but without her arms, she can't do it. Now, if she leans forward and then go ahead and stand up, she's able to do so. So you need to give the person room to stand up. Why don't you sit back down again? The other thing you want to say to them, because quite often what the patient wants to do is they want to grab onto the walker right away. And ideally, we'd rather have them push up with their arms to give them some assist in performing this task. So the cueing is, first, Lindsay, we're going to take a walk right now. Got the legs out of the way. We got the gait belt in place. You always have a gait belt in place if you're going to walk somebody. You're going to have the person, we're going to have you use your arms to stand up, and I want you to lean forward. So I got my hand on the belt, and we go ahead and Lindsay, go ahead and nose over the toes, lean forward, stand up. Okay?
Okay, what we're going to go cover now is positioning in bed. A lot of facilities or residents will need to be repositioned every 2 hours. That's pretty typical. In this case, that's what we're at. It's time to reposition Lindsay from supine position to her right side or slightly to her right side. Now, the number one rule is when you're working over bed is get the bed to the right height. Okay? Remember what we covered before is if you bend your elbows, there should be 8 to 12 inches between your elbows and the top of the bed. And here we clearly have more than 8 to 12 inches. Bring the bed up is really important. Another rule of thumb is just below the waistline. Okay, we're going to bring the bed up now. I've talked to a lot of CNAs who do this type of work, and I say make sure you bring the bed up, and a common response is, I don't have time, we've got to get this done, we've got people waiting. Well, take care of your back, you do have time, but you can be efficient about it. When you come in, you typically tell the person what you're doing. Okay, Lindsay, what we're going to do is we need to get you to your right side, okay? And once we get to that side, I'm going to position you so you're comfortable. And while I'm talking, you can see how I had the button pushed so the bed was rising as I'm talking, getting two things done at once, so you can have time. Now, if you look at this bed, I got the right position now, above belt level, 8 to 12 inches below the elbow. But look at this bed. Right now, the knee position is bent up. And a lot of beds have this option, okay? And what I'm going to do is flatten the bed from the hips down. You can see it flatten out now. Make sure that's down because you don't want to have someone roll on their side with the bed in a curvy position as such. Make sure the head also is not too high, okay? You don't have to have it flat, but at about such an angle there. All right. Okay, so we're going to rotate to the right. Now in this case, if the person can help, Lindsay, can you help you bring your knees up? You'll bring the knees up to here, bring the feet together, knees together, and if they're not able to, they'll help you as much as they can. Position the knees as such. Okay, we're going to take the left arm, bring it over the top of the body, right on the stomach. Okay, make sure this arm is not in the way so they don't roll and flatten out and squish their right arm. We're going to get that out of the way. Okay, and we'll start here. Now, hand positions important. We can go on the knee, and just above the belt line at the waistline is a good place where you can work rolling. And then, Lindsay, if you can help me roll over to the right, you can do that. And always communicate with the resident. If they can help, the more they can do, the better. Okay, and we're going to hand position is on the shoulder here, and over she goes. Okay, now let's go back to this position.